Ever wondered what tests and procedures you might undergo during pregnancy? You're at the right place. Today we're delving into the fascinating world of pregnancy tests and procedures. As every journey to parenthood is unique, so too are the medical paths we traverse. It's not just about the expecting mother, it's also about ensuring the health and well-being of the little one to come. From initial confirmation to routine checkups, each step is an opportunity to learn more about your baby's development and your own body. These tests and procedures are here to offer you a peace of mind to ensure that everything is progressing as it should, and to keep you informed about the wonderful journey you've embarked upon. So whether a first-time mom or a seasoned pro, we've got you covered. There's always something new to learn and explore when it comes to the miracle of life. Ready to dive into the world of pregnancy tests and procedures? Stay tuned. The first trimester, a crucial stage, let's discover the tests you might encounter. This period, spanning from conception until around the 12th week, is a pivotal time as your baby's basic physical structure begins to take shape. During this phase, certain tests and procedures are typically conducted to ensure both mother and baby are healthy and progressing well. First up, blood tests. A seemingly simple procedure, but the information gained is vast. These tests help to determine blood type, Rh factor, iron levels, hepatitis, syphilis, and HIV status, and your immunity to certain diseases such as chickenpox and rubella. It's the first step in painting a comprehensive picture of your health during this exciting journey. Other routine tests may also include testing for chlamydia, gonorrhea, herpes, and human papillomavirus, HPV. Next, we have ultrasound scans, often the most anticipated event of the first trimester. This non-invasive procedure allows us a glimpse into the womb, verifying the pregnancy, checking the baby's heartbeat, and determining the estimated due date. For many, it's the first introduction to the little one growing inside. Then, there's genetic screening. Now, don't let the term intimidate you. These are non-invasive tests conducted to assess the risk of certain genetic conditions. They usually involve a blood test and an ultrasound scan. It's important to remember these tests don't provide definitive answers, but they do offer reassurance and guidance for the journey ahead. Finally, urine tests are also commonly done. These help monitor for signs of urinary tract infections, kidney issues, or diabetes, ensuring that you and your baby remain in the best health possible. All these tests are done with the sole purpose of providing a safe and healthy environment for your baby to grow and for you to carry. They are not meant to be a cause for stress, but rather a means to ensure that your journey through pregnancy is as smooth and joy-filled as it can be. And that's the first trimester. But what about the next phase? Welcome to the second trimester. Ready to know what's in store for you? Now that you've passed the first trimester, you're likely feeling a bit more at ease, but there's still plenty to anticipate. In this chapter of your pregnancy journey, there are a couple of key tests that you should be aware of. First up is the anatomy scan. This is typically conducted between the 18th and 22nd weeks of pregnancy. This comprehensive ultrasound allows your healthcare provider to assess your baby's development and growth. They'll examine your baby's organs, measure their size, and even check out the position of the placenta. The anatomy scan is not just a medical examination, but also an exciting chance for you to catch a glimpse of your little one. Next on the list is the glucose screening test, usually performed between 24 and 28 weeks of pregnancy. This test is designed to check for gestational diabetes, a high blood sugar condition that can occur during pregnancy. You'll drink a sweet liquid and then have your blood drawn an hour later to measure your blood sugar levels. This test is crucial for ensuring both your and your baby's health. Alongside these primary tests, you might also have routine checks such as blood pressure monitoring, urine tests, and weight checks. These help to track your overall health and well-being throughout the second trimester. It's essential to remember that while these tests are standard, every pregnancy is unique. Your healthcare provider will guide you based on your individual needs and circumstances. And there you have it, a rundown of what to expect in the second trimester. These tests might seem overwhelming, but remember they're all part of the journey to ensure you and your baby are on the right track. Well, that wraps up the second trimester, but don't go anywhere, the journey is not over yet. And finally, we've reached the third trimester. Exciting, isn't it? This is the home stretch, the period of anticipation, and of course a time for a few more important tests. First up, we have the Group B strep test, or GBS for short. This is a routine swab test carried out between the 35th and 37th weeks. You see, Group B strep is a type of bacteria that can live harmlessly in our bodies, but in rare cases it can cause complications for the baby during birth. This test helps your healthcare team know if they need to take extra precautions during delivery. But don't worry, it's just a swab, nothing to fret about. Then, there's the non-stress test, also known as the NST. This test is usually done after the 26th week, and it checks your baby's heart rate and how it responds to the baby's movements. It's a simple, painless procedure where two belts are placed around your belly, one to measure the baby's heart rate, the other to detect contractions. The name non-stress refers to the fact that nothing stressful is done to cause a reaction from the baby. It's just about observing and recording, ensuring that your little one is doing well in there. Lastly, around the 36th week, you might have a pelvic exam to determine the baby's position and to check your cervix. This can give your healthcare provider a good idea of when labor might start. Again, this is a routine examination, nothing to be anxious about. Each of these tests plays a crucial role in ensuring both your health and that of your growing baby. They provide vital information that helps your healthcare team prepare for a smooth and safe delivery. So, while they might seem a little overwhelming, remember, they're all part of the journey, ensuring you and your baby are in the best possible hands. And with that, you've navigated all the trimesters. But wait, there's more! We're not quite done yet, as there's still the final preparation for labor to discuss. So, stick around. Now that you've sailed through the trimesters, let's prepare for the final stage, labor. This is the moment you've been patiently waiting for, the grand finale of your pregnancy journey. As you get closer to your due date, your healthcare provider will perform a series of tests and procedures to ensure that both you and your baby are ready for labor. One such procedure is the cervical check. This involves the healthcare provider examining the cervix to determine dilation and effacement, key indicators that labor is on the horizon. Another common procedure is the membrane sweep. This is a method to stimulate labor by gently separating the amniotic sac from the wall of the uterus. These procedures are done with the aim of ensuring a safe and smooth labor process. They provide valuable information about the progress of your body as it prepares for the arrival of your little one. And that's it. You're now well prepared for your journey through pregnancy. You've come a long way, and now you know what to expect during your pregnancy journey. We started off with the first trimester, where we uncovered the importance of early ultrasound scans and blood tests. We then transitioned into the second trimester, discussing detailed ultrasound scans and gestational diabetes screenings. The third trimester brought us closer to the arrival of your bundle of joy, emphasizing on Group B strep test and non-stress tests. We also talked about preparing for labor, where your healthcare provider assesses your cervix to see how your baby is positioned, and the readiness of your cervix for labor. Every stage of pregnancy is a new adventure, filled with anticipation and sometimes a little anxiety. But remember, knowledge is power. By understanding what to expect, you're better equipped to navigate this exciting journey. Thank you for joining us on this journey. Don't forget to like, share, and subscribe for more informative videos. Liking and sharing will allow more viewers like yourself to come in contact with our content that could bring them the same benefits you've derived from this video. Blessings to you.